have Dudley here. So a few important things to note are that when we're doing injections in a reptile, we are always doing it in the front half of the body. So I'm going to be using our front arms here and using either our biceps, which are down here, or our triceps, which are back here. So when I'm injecting, I'm going to be aiming in between these scales, because if we try to go through a scale, it's just not going to work and it's going to be painful. We're going in at about a 30-degree angle, which I'll show you next. And we're going in just firmly enough so that you feel a bit of a pop when you get through the skin tissue, because the skin is still pretty tough. And we're going in just a couple millimeters deep, so you don't have to be really deep. So when I'm giving the injection, I'm going to prop up that muscle by pinching it with my index finger and thumb, and then I'll use my other hand to do the injection. Likewise, on the underside of the arm, I'm popping up that muscle so you can see that plump up really nicely right here, and then giving the injection with my other hand. So I have my medication here that's almost ready. So to get my syringe ready for use, I'm going to be pushing my plunger back to the point that is indicated. So the 0.06 milliliter mark. So that is noted on that dose syringe, and the top of my black rubber stopper is lining up with that line. Sorry, it's not focusing very well here. And then to have this ready before I do my injection, I'm going to gently pop the cap off so that it's nice and loose, so that once I have my animal ready to give the injection, I can just shake off the cap. When you're pulling off the cap, never do it like this, because you can bounce back and stab yourself, and we don't want you to do that. So we're going to go ahead and give the injection. So if you find that you're really worried about him moving, we can do this with 2 people, but I'm just going to do it alone. You can gently wrap his head so that he's not seeing what's going on, because that can be a little stressful for them if they know what's coming. I'm bringing my arm back and pinning that against the body. Now with my needle, so my needle is now unshielded because I popped the cap off. I'm going in that bicep muscle, again between the scales at about a 30-degree angle, and you feel a little pop. So now that I'm in, I'm actually going to pull back on the plunger, and you should have a nice vacuum. So you can see that I'm pulling and it's bouncing back without me pushing. That's good. That means I'm in the muscle. If you pull back and you get air, it means that we're either not in, or we've done a little skin piercing and we're on the other side. So then we would need you to go in further or redirect. And if we have blood, it means we've actually hit a blood vessel. We'll have you remove the syringe completely and then give the injection in another location, because we don't want this to go into a blood vessel. So I've confirmed my placement because I have a nice vacuum, and I'm going to give the injection. So push gently and then hold a little pressure on the site as I pull my syringe out. I'm just going to hold pressure for about 30 seconds. If we see that there's leakage of drug, so you see a little drop of fluid after you've removed your finger, you weren't in deep enough. So you can go in a little deeper for the next injection. We don't want you to repeat the injection because we don't want to give an overdose accidentally. It's hard to know how much drug was lost to our little droplet. So I'm removing my finger, and in his case, I actually have a little drop of blood. I don't know if you can see that with this focus that isn't working really well. If you have a little blood drop, that is okay. You can just clean that up with some warm water. It's from our skin vessels and not a deeper vessel.